part 7 of our CryoClear training program. Although there's only a few slides in this section, this is actually one of the most important areas that we'd like to cover in the training. We've learned with over 200,000 treatments since the initial introduction of CryoClear that if a site is properly pre-treated, then the follow-on treatment with CryoClear and the outcomes that are seen with the client have a much greater chance of success and healthy skin growing in behind that which you've removed. Now, in looking at this section, we want to start by just recognizing, as always, the importance of the Fitzpatrick skin typing system, understanding that since 1975 this has been a staple way that people have looked at individual clients and assessed whether or not a treatment is appropriate for them or not. We know that with the darker skin types we have potentially more risks to consider, and so CryoClear is no different and our pre-treatments are no different, in that we want to keep this in mind as we look at individual patients who are influenced by the environment around themselves as well as their genetic makeup. So when we see the Fitzpatrick scale, again, everybody knows that we go from type 1 light ivory skin all the way to very dark brown, and everything in between as far as the human population is concerned. So we want to, aside from looking at the Fitzpatrick scale, keep in mind a couple other things about the patient. Their of course, skin itself and its characteristics, the age of the patient, because we know with older patients there's there's more potential for them to have trouble healing. There's also overall health, so there could be other contraindications, diabetes, lifestyle, obesity. All of those things need to be considered prior to moving forward with any treatment. Now, to keep it relatively straightforward for you as you're considering using CryoClear on a lesion, we've divided it into two main schools of thought. One, if there's a lesion that is raised and has a horny layer, which is essentially dead skin, then what we suggest as a pre-treatment is that you would use light microderm or dermaplaning to mechanically exfoliate or remove that top layer, so that what you're really getting down to is the epidermal layer. And so from there, what you can do is proceed with a hyaluronic acid serum or solution, followed by an ice globe treatment for 20 to 30 seconds prior to treatment. Now, when you put the hyaluronic acid solution on, what you're basically doing is trying to moisturize or bring water into the area that you're going to be treating with CryoClear. The ice globe also, we found, brings an added benefit in that it pre-cools down the area of the tissue that onto which the CryoClear will be sprayed. What this does is just help boost the CryoClear treatment to make sure that you get the best possible outcomes. And then finally, as a general rule, although with time and practice you'll find that you can spray for less times, you want to be very close to the lesion that you're spraying, and you want to treat it in 2 5-second sprays with a 5-second rest in between. So it's freeze for 5, thaw for 5, freeze for 5. When you do it in this manner, you will get the best treatment outcomes with those lesions that have a raised horny layer. Now, if the lesion is not raised, then it actually becomes even simpler, because what you can do then is start with making sure the area is pre-treated with a hyaluronic acid, followed by cooling it down for 20 to 30 seconds, pressing the globe on the target site to get the coolness into the area you're going to be treating, and then finally proceed with the CryoClear treatment as above, with 2 5-second treatments, 5 seconds on, 5 seconds off, 5 seconds on. When you follow these simple steps, we really have found that people using it on a variety of Fitzpatrick types really come out with the best results. As an epidermal freeze, we're minimizing any potential reaching of the dermis. We're giving ourselves the best outcome and removing years and years of accumulated melanin. So this concludes our section. Thank you very much.